Hey everybody, this is Matt Fresquez again. So today what we're going to cover is continuous infusions via IV. So what we're going to do is first start off by clearly explaining the procedure to the patient. We're going to approach the patient. Hey sir, my name is Matt, I'm paramedics. What we're going to be doing is we're going to be giving you some medication through your IV right now. It's going to help your blood pressure. It's going to make you feel better, okay? So after we've done that, we're going to go ahead and check to make sure that our line is flush. So this is going to be your primary line. So you want to open this up and then you're checking into your drip chamber right here, and you should see that you get a nice flow of fluid, which we do. We're going to clamp that off. Okay, so the next thing we're going to do is we're just going to check all of our medications to make sure that we have everything that we need. So we've received an order for Levofed. It's going to start off at 4 micrograms a minute. So we have our Levo, we have our dextrose. This is going to be our fluid that we're going to mix the medication into. We have our IV drip set. This is originally going to come in a sterile package also. We've got alcohol swabs. We're going to need this to clean our medication top and to clean our port. You're also going to need a needle or a syringe and a needle, along with a set of gloves, a sharps container, and we're going to simulate a medication label with a piece of tape, okay? So now that we've got all of our equipment set up, what we're going to do is go ahead and do our math, and then we are going to set up our drip, okay? So let's walk over here. All right, so I've set up the board here the way that I recommend that you set up your notebook when you're doing this by hand, because you've got to do all your math longhand with the actual division. So everything that I've written down, drug, dose, weight, 1 cc concentration, drip rate, and mils per hour, everything that's circled in the pink right here, those are the items that you are going to have to figure out for yourself in order to get your solution, okay? So the first two we've already got. We already know that we're working with norepinephrine or Levofed. Our dose that medical order that we've received is going to be 4 micrograms a minute. So for this patient, this is not a weight-based medication, so we can actually scratch this out. But now what we have to do is find out what our 1 cc concentration is. So what does that mean? That means when I take this vial, which contains 4 milligrams, and I put it into this bag of fluid, what is my 1 cc concentration in this whole bag after adding this, okay? So that's what we're going to figure out. So my vial of Levofed or norepinephrine comes 4 milligrams into 4 mils, okay? So we're going to add this medication into that bag. So we're going to be removing 4 cc's from this bag and adding 4 cc's from the vial. So 4 milligrams, this medication is infused in micrograms, okay? So the first thing that you have to do is convert. So how many micrograms are in a milligram? That's right, 1 milligram equals 1,000 micrograms. So this one right here is 4,000 micrograms. And we're going to go ahead and put this into a 250 cc bag. Well, you're going to do this division longhand, but essentially what you will come up to is going to equal 16 micrograms per cc. So there's the second part. Okay, I'm going to erase that just to keep things simple and not so busy. But if you did want to see the math on that, 4,000, 250, I've got my cheat sheet here. So this is going to be 1, then we're going to drop that 0, 0, 3, and 1, 5, 3 minus 2 equals 1. So now 250 goes into 1,500. Wow, I know, it's 6 times. So there's your 16. Okay, so now that we know our 1 cc concentration is 16 micrograms a minute, we're going to figure out our dose rate, okay? So what we do is we take our desired dose over our dose on hand times our vehicle. So this is a 60 set, okay? Desired dose, 4 micrograms a minute. How is that going to be delivered? Through a 60 set. What's our 1 cc concentration? That's going to be 16 micrograms per mil. Okay, so the next thing that you're going to do is you're going to multiply across, and eventually what you're going to come out to is going to be 15 drops a minute. Okay, so if you wanted to cancel, and then you do what's 6 times 4, 60 times 4, 240, divided by 16. One 16. It's 14 and 6. Yeah, sorry, I don't do division anymore. 16 goes into 80 5 times. Just double check ourselves. Okay, so it checks. So there's your 15, which is your 15 drops a minute. So remember the formula. You really want desired dose versus your dose on hand. Desired dose, dose on hand. You're kind of just multiplying straight across. So 15 drops a minute on a 60 set equals 15 mils per hour. Okay, so we've got all of our information now, all right? So the next step, let's go make our medication. So first thing that we're gonna do is confirm the order. We have everything that we need. We're gonna verify the patient allergies. Okay, Mr. Frank, have you got any allergies to any medications that you might know of, or any food sensitivities? No. Okay, his answer is gonna be no. So explaining the procedure again, okay, I'm gonna be mixing medication for you. I'm gonna get this infusion started. That's gonna infuse through your IV. So the first thing that we're gonna do is open up our bag. Okay, and we're going to inspect the bag for clarity. I've got D5W here. It's currently expired for training. The clarity is nice and clear. There's no floaties. It's not discolored. We're going to open up our IV set. It's going to come in a sterile, clean package. You're going to make sure that it's not cracked, it's not discolored, deformed, melted, anything like that. We also want to make sure we have our alcohol pads and our needles, okay? So we're also going to start, before we mix this, is go over our drugs, or our five drug rights. So that's the right drug. I need Levofed. I have Levofed. I've confirmed my patient, Mr. Frank. Yes, okay. I've confirmed my patient's allergies, and I'm also going to be going to check the dosage. We're starting off at 4 micrograms a minute. I'm going to check the time, and then I'm also going to verify the route, and then make sure that we keep track of everything, because you don't want to lose track, so make sure you scribe everything down, okay? So the first step that we're going to do, we're going to get our alcohol prep pad, and we're going to clean the port. Okay, get this sterile needle, should be non-expired, and you're going to get your sterile syringe, should also be non-expired. Okay, and now what you're going to do is you're going to withdraw 4 cc's. This is what's known as your waste. Okay, there's 4 cc's. Okay. And the next thing that we're going to do is this, when you're with your medication vial, it should have a green top or whatever color top it's going to have. It should spin around, but you don't want to use any medication where the vial is missing, because then you don't know what's in here. So we're always going to clean it. Even if it comes with a fresh, clean top that is properly secured, we're still going to clean the top of this vial, okay? So keep that nice and clean. We're going to draw up our 4, and then we're going to inject this into the vial, and we're going to withdraw our medication. Okay, so I've got 4 cc's right here. So the next thing that we're going to do is we're going to inject this into the medication. Okay, and now we can sharp it. Give it a little agitation. You want to give it don't shake it crazy, just make sure that you agitate it. Okay. I like to personally keep it in my hand. I don't like to put it down because it's very easy to get mixed up. And then you kind of, especially if you have more than one 250 cc bags on there. So the next thing that we're going to do is make our label. So the drug is Levofed or norepinephrine. The concentration is 4 milligrams in 250 cc's. Today's date, the 28th. And then I'm also going to put my initials, okay? Then we put our medication label on our bag. Don't put your bag down until that medication label is on there, okay? So here's the next important part. If you notice, I did not spike this bag before I added the medication to it, okay? That's the next step. So then what you do is you get your bag, you pull off your protective cap on your IV set, and you spike your set, okay? So at this time, this priming tubing is completely empty, okay? So the next thing that we want to do is prime it and make it full with all of our medication, okay? Squeeze the bag a little bit. Okay. So now my medication is mixed and my line is primed. So what we do next is we're going to come over to our patient. We're going to hang our bag. We want to make sure that our primary line sits lower than our medication infusion line. Otherwise, the meds are just going to go back up into here, okay? So the next thing that we do is we get an alcohol swab. We've already verified allergies in Dr. Pat's. We're going to clean our site. And then we're going to go ahead and set our infusion rate, okay? So 15 drops a minute equals 1 drop every 4 seconds. And how did I come to that number? Well, how many seconds are in 1 minute? 60. How many times does 15 go into 60? 4. So we want 1 drop every 4 seconds. All right. So then we just note that we've started our infusion at the current time, and if you can see my drip chamber, you're getting about 1 drop every 4 seconds, okay? That should conclude your continuous infusion, and good luck to you guys.